Good morning and welcome again to yet another snippet of how AI can help us in day-to-day issues in the hospital. So this is particularly in fall prevention in the hospitals. The clinical scenarios are from my personal collection and I've obtained consent. So fall prevention in hospitals, post-operative patients are at high risk. Falls lead to naturally to extended hospital stays and complications and rehospitalization. So there need to be a proactive fall prevention strategies. These strategies are very much there as part as the quality improvement issues in the hospitals. But now AI has come and given some more support to this initiative. So one example, this is a patient, a young patient, post-operative day 0, that is the same day. He's had an appendicectomy. You can see the bandage there. You can see the dressing. He's had an appendicectomy under spinal anesthesia. In the evening, when he wanted to go to the washroom, he fell down from the bed and had a severe injury to the ankle. Now, let's not go into the technical part of the injury, the ankle, but it is not something minor. He needed to be on a POP now. So somebody coming with an appendicitis, getting operated and going back with something more. It can't be buy one, get two. It's very unfair. Now, you must understand that certain patients will have this propensity to fall. The staff are always in shortage. They cannot be seeing all the patients, but an AI will be a second pair of eyes to look at patients who have high risk. Not only that, this is real time. They can also pick up high risk at probably 4 p.m. Out of the high risk patients of 12 in the post-operative ward, AI will be able to flag this patient A is likely to fall now. So it makes a lot of difference to the nursing care. So now have a look. These are two videos. This patient has had a Symes amputation. There is an ulcer there and she has come to us. You can see the gait. Anybody knows the lady with this gait is likely to fall down somewhere. Have a look at this patient. She's had an amputation, BK amputation done, and she's trying to walk with the walker. So these are the definitely high risk patients. And then there is a risk model. You have rule-based risk systems which will be able to risk stratify the patients at high risk for fall. So now this is from the cloud physician. They have a system or a software in place which will be able to exactly, there are multiple cameras over one patient, so that the very fact they sit up in the bed, they are a risk for fall. Particular frame will flag the caregivers. They know there is an issue with that bed. So this is how the AI will work. The AI itself will flag. It's not that somebody is sitting and looking at all the frames. The AI itself has flagged it. This is not from my collection. I want to tell you again, this is from the cloud physician. So now what is the role of AI in fall prevention? It predicts fall risk before the incident itself. Detects falls in real term. It doesn't just give you a risk, but it tells you that this patient is going to fall in the next few seconds. It supports personalized prevention strategies. You know, these people are highly at risk for fall, you will have your strategy in place. You will look at the sedation charts. You will make sure that the alarms in the bedside are working. You will make sure that they have very supervised ambulation grades. How does it work? What does it do? It will analyze data and electronic health records in real time. It will be checking what sedative dose he's having. It will be also checking the BP reading at that point of time. It will identify high-risk patients post-surgery, naturally with these parameters. It will even monitor your gait. The previous two patients with amputation, what I showed you, they were obvious. You know, anybody can tell that they are likely to fall. Their gaits were unsteady. But AI will pick up even subtler clues. Now, how you can have smart sensors and cameras in the patient rooms with alarms and wearable track motion and detect fall patterns. Now, what are the smart interventions? AI-driven personalized mobility exercise plans. They can tell you this is how the grade of ambulation should start. Medication reviews. It will be constantly reviewing the medication. Voice assistance and reminders for safe movement. These are all important. It's sort of a personal nursing assistant to make sure that falls are prevented. Naturally, the challenges will be patient privacy, your infrastructure, your cost, and then your training. In fact, these are very, very sort of generic issues. You can easily put it in all your challenges. The same thing, privacy and concern, cost and technical aspects. What are the real world software? Care Predict, Safely You, and Fall Skip. These are the various softwares which will give you this particular input and stratify fall scores. What is the benefit? Naturally, it will reduce the incidence, it will increase the patient recovery outcomes, and it will decrease hospital costs as well as caregiver burden. Now, a caregiver has come and stayed with that patient for appendectomy. Now, the same caregiver or another caregiver has to step in because he has got an injury to the ankle. So now, I just wanted to put how AI is helping. I put this image of that lady who was BK amputation. I could not put a video image, so I just put a still image. And I asked what are the outputs. Promptly, this is ChatGPT, it told me it's a female using a walker, has a bandaged or a right leg suggesting surgery, is transitioning from bed to standing, which is a high risk activity for falls. Transitioning of movements is a high risk activity, and there is no footwear and the floor is smooth. I just gave this image. I did not give any more details. The AI has picked up all this, and this is a general model, your ChatGPT. More so, if your model is trained only to look at fall parameters, it will perform much better. It has picked up the risk factors which it could pick on the image. The other info like depression and other things, we did not feed it, so it's given 0. Now, in spite of it, it has given a score of 4. So this is very important. In spite of missing parameters for the model, still it has got some parameters which are heavily weighted. For example, the smooth floor, the amputation here, and the walking aid, and it has given a score of 4. So what do you do now? And it also gives you the suggestion. All of us know that patient has a problem, but we are not able to pare it down to the exact problem to bring the exact solutions. It has told non-slip socks for footwear, physiotherapy and rehab support, supervised ambulation. You can see she was walking alone. Clear path with support rails if possible. Pain management as pain affects gait. Very important. We did not even ask her whether the stump is still paining. These are the things which AI will draw your attention to. It has thrown 4 suggestions We all know grossly there is a problem, but we didn't know how to cut down the problem and bring the specific solutions. This is how AI helps. Now, AI has not taken over the task of making sure she doesn't fall, but it has given you a lot of input. When you were busy looking at the patient, it has flagged its own inputs and it is trying to guide you to give the best care to the patient. So that is about fall prevent, how you can use AI to fall prevent. And this is on behalf of Dogstripe AI. Thank you very much.